All right, all right, all right. So we just talked about that Social Security kind of thing going at OASDI, Old Age Survivor Disability Income. So who's it for? It's for old people, right? If you were married and your spouse kicked the bucket and you survived, that 255 is all yours, that death benefit. And then for that disability income, just remember, this ain't Aflac, guys. If you're going to get SSI benefits, that means that your disability is expected to last at least a year. Your benefits don't kick in for at least, I shouldn't say at least, don't kick in for 5 months, which means you're on your own. You ever heard of that emergency reserve? I hope so. And last but not least, let's just say, your disability is not only going to last at least a year, you might die because of it. Those are really, really bad freaking terms, all right? Now just remember, SSI is not Aflac, is not a long-term care policy, is none of the above, is not Medicare. It is basically a dirt floor for the God forbid or what if. Sticking with dirt floors, we're going to transition into Medicaid. Why? Because if you don't have any money, bro, you're not picking your providers. You know what I mean? It's not like you can not contribute into the system and all of a sudden, have valet like Illumina Healthcare down there. And look, I'm getting ahead of myself. This Medicaid, all right? Medicaid, guys. What does it mean? Low income. Period. Low income. Indigent elderly. I'm not sure what that indigent word means. Definition of indigent right here. Elderly. They can't take care of themselves, right? Why? Social Security doesn't pay you that much. A lot of these seniors are living off of Social Security, right? Who else is normally involved in Medicaid? Well, according to the statistics, it's single moms, it's people with AIDS, it's babies born addicted to drugs. So, and then our seniors, right? The indigent seniors, I guess that's kind of a little bit of combination of them all. God, why do I keep on dogging the seniors just because you're not in this class? I'm just kidding. Ma, I'm kidding. Just kidding. All right. Anyway, so we got it, right? Medicaid. Poor people, if you got really just in a nutshell, poor, but blind, disabled, under 21 kids, right? Now, if you're following along in the Kaplan book, that little definition right there is in chapter 16.33 on page 287. If we jump ahead a little bit, because I'm always talking about how much I love the Kaplan book, right? You know how much I love this manual. But anyway, we're just going to jump from page 287 to 333, okay? Now on page 333, I'm just going to go ahead and tell you, my dog just ran out of here. My dog said, what? I didn't pee, I swear. But look, in reference to Medicare, one of the... she got mad, right? I got an old little Shih Tzu, little Marley. I'll show you, right? That's my senior. I am her long-term care facility, all right? She be coming in the house sometimes, looking at me like, yo, come wipe me. But anyway, if she wanted to qualify for Medicaid, she's got to prove she's got no dough, all right? So if you want to go ahead and qualify for Medicaid, I keep on telling you that it's low income, but what if you do have a lot of money and you're just really cheap and you're trying to get over on the system and you're kind of healthy and you don't really need much? Would it work for you? Yeah, but let me tell you how people try to get over on this, okay? So Medicare does not cover nursing home facilities, okay? I mean, if you're dying, it'll cover hospice. But that's assuming you're dying, okay? Like you're not trying to get better. We're just waiting this out. So Medicare covers that. But now let's talk about you might not die. You just need this nursing home care, okay? Medicaid Medicaid does provide it, right? Because if you can't do it for yourself, we can't have a bunch of you guys walking around here, causing havoc in the streets with nobody watching for you, right? It'd be crazy out there. Can you imagine? It'd be like herds of, zombies from what? Come wipe me. Where's my pills? Nah. So Medicaid covers all those things, right? So seniors actually do have nursing home coverage. But now let's back up. What's the problem with this nursing home coverage? Because, they do cover custodial care, and that's just where, you have somebody who's not skilled nursing giving you help. But let's push past that and go to this qualifying for nursing home care, right? Medicaid, you can't afford it. You can't afford it. That's why let's just say, I'm trying to get over on it, right? I want to give my money to my kids. And so what I do is I want to qualify for nursing home care because Kelly is not wiping me. That's just not her thing, man. She's a little high maintenance, and I can't be high maintenance in this relationship. It just doesn't work out for me, right? So I'm trying to get my money away so that way I can get Medicaid to come wipe me. If I were to qualify and I do get my money out and I go ahead and apply for Medicaid and I meet the criteria because I transferred all my assets away from me, do you know the federal government can actually look up? They call it a look back period. They get to look back 5 years just to check to see if I transferred assets away from me for less than market value. Okay? That loophole of transferring money away is gone. Guys, you could be criminally liable for transferring money out of your portfolio to qualify for Medicaid benefits. Now, let's talk about what happens if during that look back period they were to find out that, let's use round numbers here, all right? We transferred $160,000 of assets away from myself to the kids. Why did I use 160? Because in the state of Florida, national averages, nursing home care, private nursing home care is going to cost you about $80,000 a year. So if I transferred that 160 during that look back period and they find out, what happens is that I enter into an ineligibility period where I basically, Medicaid is not going to pay for my services. Why? Because I went out of my way to qualify for these services. How this ineligibility period works, it's the amount that you transferred away for yourself divided by the average cost of a private nursing home care, okay? Because a semi-private room is going to be in that like $40,000 to $50,000 range. A private room is going to be in that $80,000 range. So if I transferred $160,000 away, how much ineligible time am I going to be slapped with? 1 year. 2 years. They're not going to pay for my nursing come wipe me care for 2 years, guys. All right? That's the problem with Medicare. So what I want you to really remember about Medicare here is that it is for poor people, people under 21, so kids, old people, right? And it does cover nursing home care. And so the fact that you have to be poor to qualify for your nursing home care means that the federal government went and slapped some restrictions on this and said, yo, if you're going to qualify, you got to legitimately qualify. You can't push these assets off. And if we catch you pushing these assets off, we're going to go ahead and take away from your benefits. And we're going to calculate whatever that is based on private nursing home care. So, of course, I gave you ballpark figures with the 160,000, the 80,000 in the per year in private, just so you can see the ineligibility period would be 2 years. Okay. Now, and lastly, how long was that look back period? 5 long years. And that, my friends, is Medicaid. Yo, Ronnie,
Yes.
how are we going to do this now? What are we going to do? We're going to go ahead and talk about some Medicaid for my Latinos? Yo, you guys know. So I love this because as we start working over, we work on this class, I'm sitting there trying to keep track of the key words and stuff. So, I throw the flair in and Ronnie comes in, it's all serious and all suave. It's like, yo, mira, let me explain this to you. But watch, man, within the next year, I want to be giving this class, all right? It's going to be me. I'm going to be up there. I'm going to be like Frank Perdue selling chickens on the Spanish channel back in the days. You remember him? Comes mi pollos está bueno.